Joining me is Carolee Barlow, MD, PhD. She's from the Parkinsons Institute and Clinical Center. Tell me about the model of your institute and center. It's a little bit different, right?
It's very different.
Tell me about that.
So the Parkinson's Institute was founded about 25 years ago by Dr. Bill Langston. And his idea was to create a nonprofit institute whose only mission is Parkinson's. So unlike an academic center where you have a neurology department that takes care of all sorts of different people with different diseases, research in lots of areas, this institute is completely focused on Parkinson's disease. So we provide cutting-edge clinical care. We have physical therapy, occupational therapy, all of the things that patients need, but we also are heavily involved in participating in clinical trials. We have an entire clinical trials group, and then we also do the basic science research. And our institute is very devoted to the type of research that we've come to call translational research, where we're really working directly and interacting with our clinicians and our patients to figure out how to partner to move research forward so that we can bring new treatments to the clinic. So it's a very unique kind of model, and I think a model that's uniquely positioned to take advantage of some of the advancements that are coming forward.
It just makes sense.
It does make sense.
Now, should people who've been diagnosed with PD have some hope that you guys are out there doing this way?
Absolutely.
Yeah.
So I think there's many reasons to be hopeful. I think anyone who has a loved one, a friend, or themselves is affected by a serious disease, just having a center that you know is completely focused on your disease for education, outreach, helping your partners, your spouses, your families, helping all of you to cope with this new diagnosis, that alone is reason for hope. You're not in it alone, we're there to help you. But while that's all happening, we also have the opportunity to start working closely with our patients to think about what are the best new therapies that look like are coming out of the biotechnology and pharmaceutical industry. We have a big party going on in the background here.
I love it. Don't worry, you won't even hear it. You won't even know it. It's amazing how you won't even hear it, but that's unsettling for you right now, but okay.
So I'm going to ignore the party.
Ignore it, right.
So the nice thing is, by having such a close interaction with our patients, also having this research, we have insights into the pharmaceutical and biotechnology companies for the new drugs that they're trying to develop. And by having us as a unique partner with every single stakeholder, we think there are many ways to be hopeful. One of the things we want to do at the Institute is also to begin reaching out to additional stakeholders like the Food and Drug Administration, the FDA, because they have a huge stake in how we think about developing new drugs. So we want to be that come-to place for looking at the best new therapies, helping get those therapies into clinical trials, and also discovering new therapies as we continue to move forward in the research area.
And getting them to people as soon as possible.
As soon as
and
possible.
not getting them tied up in red tape with the
Exactly.
gatekeepers.
Yes, and that's, I think, what you just
Right.
said is key. There are lots of different stakeholders which can also be gatekeepers.
Right.
And part of the challenge of Parkinson's is that we need every stakeholder to come together so no one's holding up progress.
Right.
And we think it's really important that we engage patient advocacy, the FDA, which is a very serious gatekeeper, as well as the pharmaceutical and biotechnology industry, so we can be innovative and proactive and not slow down development.
What do you think of the walk?
Fantastic.
You had a good time?
It's fantastic.
It's amazing, right?
First time I've ever done the walk. Extremely inspirational. Just to see how many people are interested in making a solution, being part of the solution. And I think one of the things is you're walking, and every step you're taking, you're seeing someone coming in, stepping along with you, who you can feel that they have the same mission that we do, and they're empowering us to achieve what we want to help cure Parkinson's.
It's like a big hug.
It's a giant hug.
It's like a big hug. But it's important to point out, some people reach out to me, because I've done this for many years, and they say, I don't know if I'm up to the walk, and I say, it's not about that, it's a stroll. We're all in it together. It's slow paced. This is nobody's winning this. This is just all to be together.
Yes.
To ask the questions of the smartest researchers and the greatest foundations across this country that we have, bringing to bear their knowledge and sharing.
Yeah.
You know? That's
Absolutely.
what it's about. It's so good. Thank you so much.
You're welcome. Very nice to meet you.
Nice to meet you. This is Leslie Chambers from the American Parkinson's Disease Foundation. Thanks for being here.
Thanks, Michelle. We're pleased to be here.
Tell us what kind of brings you in. You're from Staten Island. You guys are based there.
That's where our national headquarters is.
what gets you involved with a Parkinson's Unity Walk every single year?
So this is a great opportunity for our organization to come together to show the support of all of our sister organizations. And we encourage members from our chapters around the country to come here to display their commitment to Parkinson's and their work with all the other organizations here in the park.
How would you, for people who haven't seen this, how would you describe it to folks?
It's all about energy, and we like to say optimism, because it's about an opportunity for people to come together to talk about ways that they're battling this disease on a daily basis, whether it's through fundraising or supporting one another through advocacy efforts, but also about health and wellness, about all the things you can do even though you have this really, really difficult disease. So it's a really great time to share all that excitement, energy, and optimism.
Well, you guys are a part of filling people's toolboxes too, in terms of educating people, stressing the importance of certain medications and sticking with your doctor, moving, all of those things.
That's right.
Does this day help with that as well, getting the word out?
It's great, and we have an opportunity to share that information, to get that word out, and to let people know that we're around the entire country. We're the largest grassroots organization with a dual mission, and that's to ease the burden, and that's exactly how we do that, through education, through empowering patients and caregivers about the things that they can do to manage their illness, to take care of the latest in terms of disease management, and about research. We want to get people involved in clinical trials so they really feel like they're doing something positive about their disease.
Do you think it makes a big difference that 100% of the money raised for this walk goes straight to research?
Oh, it's the best commercial for a really good fundraising effort. And you read something in the article just about every day about how much money is wasted in fundraising efforts. Not here. This money goes to research. It goes directly to our scientists, and that's really exciting.
It's a real shot in the arm.
It sure is.
Really
Yeah,
is.
absolutely.
Anything else to talk about?
We're just thrilled to be here, and we're hoping there's a day when we don't have to be here. So appreciate it.
Exactly.
Thanks a lot.
Thank you.
All right. Thank you.
Thank you. This is Carol Walton, who is CEO of the Parkinson Alliance. Very good friend. What a great day. You have to be thrilled. You're thrilled,
and look
right?
at the sun. It rained a half an inch, they said, at 5 o'clock in the morning, and the sun came out. And this community deserves it, Michelle.
It's true.
They work really hard. They deserve it.
Now, explain, for people who don't understand what it is, you guys do so many things with the Parkinson Alliance. So tell us how that works.
Parkinson Alliance is the umbrella organization. We're going to talk about the walk, but there's two other really important parts. One organization is called Team Parkinson. You met John Ball and Edna Ball last night. We call him Marathon Man. John has had Parkinson's between pre-diagnosis for almost 40 years and has run 26 marathons and an ultra marathon.
Wow.
I know. His wife Edna is also our co-chair. They're based in Los Angeles. Her mother had Parkinson's for 37 years, and now she's lived with John and been married over 40 years. So Edna has had Parkinson's in her life since the age of 11. Wow. And together they're just so wonderful about educating people and the importance of exercise and a quality of life. John has done, like I said, 26 marathons. He's kind of focusing now, and he's still going to do some full marathons, but he's really going to concentrate more on doing half marathons and 5K. So I think we're going to branch out with that organization. It's comprehensive on what exercise does for you, not just focused only on marathons. And the other part of our organization I really want to talk about is the work that we do in patient surveys. Our president, Margaret Tuckman, has had Parkinson's for over 36 years, and she had deep brain stimulation way before it was FDA approved in New York in 2000. And she really felt it gave her about 10, 12 years of her life back.
Wow.
Because she was the right candidate. And after that, she said, I really want to make our organization one place where people can go in the community and find quality information on this therapy. It's great if you're a good candidate, but if you're not, it is really not. And it treats the motor symptoms. So Margaret started out, first thing we did is a patient survey. And then we started to grow, and we decided we should have a control group. We did deep brain stimulation patients only at first. And now we have a control group, so everyone has Parkinson's, and part of them have DBS and part of them do not. We just finished our 18th survey. We have over 8,000 survey responses because we have a good retention rate. People come back. And everything is on our website, dbs4pd.org, so you can download it for free. And in April of 2009, we actually sponsored a consensus conference, and we flew 50 neurosurgeons and movement disorder specialists in from all over the world. and they agreed on certain things like who's a good candidate for deep brain stimulation, and what are the symptoms it really helps, what are the symptoms it will not help, how long should the process take to get an adjustment that really works for you. We got that published in the Archives of Neurology, and all that is up on our website. So there's a lot of really quality information. And anyone that has Parkinson's, whether you have DBS or not, we'd love you to call us. Every single person that helps us participate is like gold. And you're doing a great job of educating the community. So that's the second part.
And all of this happens over at Margot Zobel Way. I mean,
absolutely, everything's there.
That's the thing. This whole conversation happens over and over again. Like,
it does.
What trials could there be? What could I be a candidate? How can I help someone I love who's been diagnosed with PD?
Absolutely.
But tell me a little bit about the Unity Walk and what it's more into. I mean, we've got a Twitter board this year.
I know.
Great. It's so fun. Every year there's something new, and it's better and it's bigger.
Yeah, and really this is the biggest one.
Yeah.
Really, well over 11,000 people. You know, first of all, it's about fundraising. So last year we raised over 1.7 million for research. I hope we do equal to or greater than. And 100% of those donations go to research. But equally as important is the fact that this is about community and education. And one of our biggest messages is that if you think you're diagnosed with Parkinson's, because some people are misdiagnosed, you absolutely must make sure you see a movement disorder specialist, Michelle. And that's a neurologist, a general neurologist with an extra 2 years of training. So they really understand movement disorders like Parkinson's disease. Usually they have a very large patient population of people with Parkinson's. And although we don't have the cause and cure yet, we have so many therapies for Parkinson's. But you have to be with that specialist to learn how to mix that cocktail of medications. And if you could talk to someone who had been going to like a primary care or general neurologist, and then they call the office and you hook them up with a movement disorder doctor, it's just unbelievable what they call back and say. It can change your life. With the right mix of medications and timing, you can increase or decrease by half an hour, 45 minutes, and it makes such a difference in the quality of life. We want to make sure we get that message out to people. And one of our biggest booths here is called Ask the Healthcare Expert. And we have movement disorder doctors and neurosurgeons and occupational therapists and physical therapists and nutritionists. They're all in there donating their time, and people can just come and ask questions. Plus we have all the major foundations that are recipients, as well as vendors. People like Medtronic and other people, pharma companies, Teva is here, UCB, they're all on the website. And they're all here with representatives giving all this free information. So we do this webcast so that people who are not here have the same opportunity.
It's like they're here.
It's like they're here. They have access to all the information, so everybody has a chance to get that education.
There was a group of women from, I want to say it's Andrea's Angels, talking to me a little while ago.
Okay.
And one of the women said to me, she's like, I'm so much happier after today. I'm so much smarter, and I know I'm going to be healthier.
Yes.
That's the thing.
And she's got all the resources.
That's it.
Yep.
That's it. That's what today's about.
Yep. And our #1 team, Jim has a saying that this one day takes a negative and turns it into a total positive. And he does that for the rest of his life. Yeah, it's awesome.
Thank you.
Thank you.
I think we're good.
I know, we're good.
I think we're good.
It's a wrap. It's a wrap.